this forum or participating in this DORAI Foundation. I've only seen in Facebook and all that what you guys do. You guys have been doing a marvelous job generally related to mental health and other issues also. Uh, so I was first impressed that they have selected this particular topic itself. And the questions also very well framed. I'm not sure who did that.
Sir, I did.
You did that. The questions also very nice, but because right now this is a time where there is a pandemic going on. We are having this COVID pandemic, but apart from COVID, we are also having other diseases as usual. Psychiatric issues are there, psychiatric illnesses are there, and illnesses like malaria, dengue are still there. And many times they are misdiagnosed as COVID or just they are not diagnosed. COVID diagnosis itself is not made, or people are thinking all fever is only COVID. Now with Omicron is having a very high positivity rate. When you test for say 100 patients, now 17.7 or something. Today's Hindu says 17.7% is testing positive for Omicron for the COVID. So which is a very high rate, but still there is an 80% of fever which is not COVID, and many of the fevers could be one of the major issues as far as India is concerned. Previously, when we were like youngsters, we were like say young doctors emerging from MMC and all that, malaria was a big thing. Fever means malaria. You can empirically start chloroquine and other things. Somebody comes on fever, they give 2 or 3 one shot, they'll give 1 chloroquine, then 1 chloramphenicol, like that. They'll treat for various diseases. One is for say malaria, one is for say typhoid, without any testing also. Some of the GPs used to do like that. And some people are very meticulous and they go with protocol, they just wait, they just give only paracetamol. After a few days they do all the testing, proper testing and all that. Once they come to say when the laboratory diagnosis confirms what you clinically suspect, they arrive at a diagnosis, then start a particular medication like that. That some people have that kind of a very systematic approach, while some guys have just one shot approach. That's how things used to be when we were young. Now, so dengue, having said that, dengue is equally prevalent. There is a very high prevalence of dengue even in the COVID era. And malaria, dengue has pushed back even malaria. It has come to the forefront. But that doesn't mean malaria is not there, still malaria is there. So, but malaria is a bigger issue in say tropical countries like say Africa. Dengue is also equally big. This is more of a tropical diseases. They used to be tropical, they are called tropical diseases because they are much more prevalent. If you look at any white men or say Australians or say any Americans traveling, they'll be carrying all chloroquine, and if they're traveling to India, they'll take some tablets to protect themselves from malaria and all that. Proguanil, one tablet is there. So they'll take that tablet to prevent. So that is the kind of scenario is present. Now, the overall topic is in this medical conditions called dengue and malaria, they also have psychological issues. It's not that they have only psychiatry, they have only medical issues. They might have, some of them might have psychological issues as well. And that is what we are, as psychiatrists, as mental health teams and all the other things, we are much more worried about those aspects of dengue and malaria. So overall the time given to me is 5:30. So I'll try to finish by 5:30, maybe 5 minutes extra, I don't know. So we'll go questions. I've been given 11 questions. I'll go one by one. I didn't prepare any PowerPoint or something. There was some time, but I jotted down some points as to what to say and other things, so I'll just go through that. So the first question is, does dengue patients face depression and anxiety? Definitely yes. If you are having dengue or once you are diagnosed as dengue, definitely you will have high prevalence of depression, anxiety and other things. The second question is, does patient with past dengue or malaria have a higher chance of developing? Yes. Post fever, any fever, following the fever, you develop something called chronic fatigue syndrome. There is something called chronic fatigue syndrome where the patient feels very tired. It's almost like a it's almost like a mild chronic depression. It may last for months together. You feel very tired. You don't feel energetic. You don't feel like working. You lost interest. It may not be severe like suicidal and other things. It may not be, but still some mild fatigue and those things could be there. So this is can be present for any of the fever, post fevers, even for dengue, malaria, or even for COVID. Post COVID also, you can get a lot of depression, anxiety, or even post. So previously the chikungunya fever was there, right? The chikungunya also causes a lot of joint problem, joint pains and other things. So that time also they found many of them have anxiety. So any of the viral diseases, it's called post-viral syndrome. So that is there. So dengue is also a viral illness. So dengue is basically a viral illness. There are 3 or 4 strains of dengue, and if you want to diagnose somebody as dengue, after 3 or 4 days of fever, you can start. You can do a certain blood tests are there. So dengue, IgM, IgG, dengue tests are there. You just can give in the lab and to tell you whether it's positive or negative. And one of the, very clinically speaking, one of the common things that we see in dengue is the platelet count. The platelet count goes down, especially that could be, you may feel very worried about that. Is there going to be any complication? But we not be worried about that, but usually it's transient, it reverses after some time, and usually doesn't warrant any say even they don't even up to 10,000, 20,000. The normal platelet count is 2.5 lakhs, 1.5 to 4.5 like that. Only if it goes less than 1.5 we start thinking, or if it goes less than 1 lakh. But for some children goes to 10,000, 20,000 also, they don't give any platelet transfusion. If it goes very less, of course we have options like platelet transfusion can be done. But that's done only very rarely. Because it's a very transient illness, it usually recovers, usually it's mild, we need not worry. Now, of course there are, I'll come to the other symptoms and other things. Now, what are the symptoms of dengue? That is the next question. Regarding symptoms of dengue, you can have usually high fever, very high fever like 103, 104, severe headache, skin rashes, vomiting could be there, pain, body pain, muscle pain, joint pain, retroorbital pain or retroocular pain. There could be a lot of pain behind the eye. So these are some of the common symptoms of dengue. If you take 75% of dengue infection, they will be asymptomatic. There is no symptom at all. And 20% only will have mild to moderate. That is what the fever, headache and all that what I am saying. But 5% may develop may have a necessity for hospitalization. They may go in for complications. That is the dengue hemorrhagic fever, dengue shock syndrome, conditions like that are there. These are some of the very severe complicated stages of dengue. 5% of population, that is why we are much more worried about this condition. So usually they do, after the dengue fever subsides, they may do some ultrasound abdomen or ultrasound chest to see if there is any ascites, pleural effusion, if there is any fluid collection. They'll recheck the platelet counts and all that. The pediatrician takes a lot of effort to ensure that the convalescence is smooth. Okay, because many people they will recover normally, then finally they may go in for another complication. So even after 1 or 2 weeks, you have to be very careful. So that is regarding the symptoms of dengue. That is the third question. What are the symptoms of dengue? Dengue is pandemic or endemic? One question they has been raised. So for that you should understand what is an epidemic, what is a pandemic, and what is an endemic. When you say epidemic, it is a disease that affects a number of people within a community, population, or a region. Say we are living in India or Tamil Nadu, and say suddenly one particular disease spreads very widely in this particular area, say Tamil Nadu, then I can say there is an epidemic of dengue in Tamil Nadu. Okay. When we say pandemic, it is an epidemic that spreads over multiple countries or continents. It doesn't restrict itself to one country or one continent. That is why the word pan is used. Pandemic means it goes to several continents, several countries, almost all the countries in all the. That is why COVID is called a pandemic. Whereas we may not use the word pandemic for dengue because as I said, it's more of tropical presence and all that. It's more of it could an endemic is something that belongs to a particular people or country. Only this particular country or this particular area it is very highly. Then you can use the word endemic. You can say dengue is an epidemic. That's it. Dengue is more of an epidemic that is spreading a lot widely in India. It's an epidemic in Africa. There are times when in 2020 it was a pandemic as well. Like 2020, dengue was a pandemic. So the same condition could be endemic, could sometimes epidemic, sometimes pandemic. Pandemic means many countries, endemic means one particular local area, and epidemic means spreading fast in that particular area. That is epidemic. Endemic means usually say fluorosis, because there is lack of fluorine content in that particular water or something. That a lot of people develop fluorosis in that region. Then we say fluorosis is endemic to that particular region. Because in that particular region there is something that is causing the particular disease. So that's where we use the word endemic. Epidemic, that is more for various conditions they use the word endemic. Epidemic is the word they use for infections which are spreading very widely. You will use the word epidemic. If that epidemic is only one country, one area, then epidemic. Multiple countries, pandemic. So dengue can be an epidemic, can be a pandemic. But you cannot say it's endemic. It's not particular one particular region, not like that.
But sir, as of today, from WHO, we hear many statements that COVID is going to be a endemic, then going through a phase of. Right now, it's a pandemic, but it will become a endemic, right? Like that. That's where this question came into my mind.
Yeah, endemic means it's particular area. It's localized with. So the idea of WHO is to reduce your fear. From pandemic to endemic means certain countries at certain points of time it will be there. It won't be in all the countries all the time. So that is what's happening right now, no? Because Africa is seeing a surge, and after some time India is seeing a surge, after some time UK is seeing a surge. It's not there at the same time at all countries. So slowly that, but initially we saw all the countries were affected at the same time. So,
And sir, in sorry to cut you. Sorry.
yeah. What you wanted to say something?
So just a question: as we see in the case of dengue, it's not throughout the year. It's in a particular time of year. Like a couple of months back, only we were seeing that most of the people were getting dengue.
Yeah, usually
But
it's
right
more of
now,
an
it's not the
epidemic.
situation.
Epidemic. Yeah. You can use the word epidemic. It suddenly develops, suddenly it increases, but it's always there to an extent. So the same condition could fit in all the categories depending on the time, situation, and all that. Okay. So that is to answer that particular question. The next question that has been raised is what post-psychological effects does dengue have? So for that, the answer is one is there have been numerous case reports of mania. Most of you have mental health background and all that, you know these words and all that. So some people have clear-cut manic features during the febrile phase of the illness. They may be very talkative, authoritative, irritable, grandiose, increased sexual behavior, reduced sleep, like that. and which will be controlled within a month if you use like any other psychiatric illness which we treat with antipsychotics and mood stabilizers. So dengue can cause mania kind of an illness. Many of them have anxiety. Almost 80% of them might have severe anxiety. They also have fear of death. Dengue patients develop, they especially adults. So even children may not be aware of things like death and other things. But whereas when adults go through that, they have great fear of death and all that. And 20% have panic attacks. They may get very worried. You know what is a panic attack? Your panic attack, like, suddenly your heart goes bang, 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 and you sweat and all that. It happens often, recurrent, and that's why then you call it a panic disorder. So you can get panic attacks, and 80% have anxiety-related symptoms. The symptoms are reduced. They improve fast. If you give only some anti-anxiolytics or antidepressants, they improve fast, and usually there's a good prognosis. And depressive symptoms are also common. 50 to 60% patients might have depression. Okay. Initially, but if you look at the later phase, as the patient improves and all that, even beyond certain, say 2 months, 3 months, then 5 to 20% will still have depression. So many of them may be transient, not a typical psychiatric disorder. Like when you take a typical psychiatric illness, it will be kind of it's persistent, it is a long term, you need to take medications for a very long term and all that. But usually many of these fever related things are much more shorter duration, maybe 3 months, or sometimes it will precipitate a long term illness. This may be it may precipitate a first episode of a long term illness. So that is a different story. But usually most of the depression, all that is transient. And the anxiety, more the symptoms, more the anxiety and depression. The more you go through pain, the more you have this body pain, or say fever is very severe, more the pain, more could be the anxiety or depression. And dengue related psychosis also is there. Some patient may have psychosis like hallucinations, delusions, emotional lability, disturbed self-care. Okay, but with the treatment they improve fast. Catatonia also can develop, like mutism, stupor, posturing. You know what is catatonia? Catatonia also can develop. Most of this is because there is capillary leakage in the extravascular space, there is cerebral edema. Okay. In very severe conditions, they may go for delirium, paraplegia, encephalopathy, like that. Okay. So these are some of the answers to the particular question, which is what are the psychological issues in dengue, right? Next question is, what are the symptoms of malaria? Okay. What are the symptoms of dengue? I think already we've gone through that one. Question number 7, what are the symptoms of malaria?
Psychiatric symptoms of malaria, sir.
First is symptoms, 6 is symptoms,
Yeah,
7 is
symptoms and psychiatric symptoms.
then psychiatric symptoms is the question, right? So symptoms of malaria is very simple. You have this fever, you have very severe fever, you have the chillness, you have the they call rigors. Patient will develop a lot of rigors, and usually again it's very transient. They may develop very high grade fever. So these are some of the symptoms, and usually it's a transient. Once you diagnose, it's usually once you treat them with chloroquine, they usually respond very well. And you know, malaria is caused by the mosquito bite, as well as dengue is also caused by the mosquito bite. Different types of mosquito. Dengue is caused by Aedes aegypti. There's a mosquito called Aedes aegypti, and there's a variant called Aedes albopictus. Albopictus is a day biter. Whereas here it's a female Anopheles mosquito. It's biting and spreading this malaria. There was a joke yesterday, Wally on interview I saw. He said, why, somebody asked, it seems Crazy Mohan, they asked why this Ramar was in the forest now. Ramar was in the forest. Why there were no mosquitoes biting him? Or why he didn't develop malaria? They asked. And Crazy Mohan's son, he asked Crazy Mohan's son to give the reply. He's writing. And he said, because the mosquito that spreads is a female mosquito, it will not bite Rama. Lord Rama is immune to all females. You know? He'll only look at Sita. He doesn't look at other females, right? So the female mosquitoes cannot go near Rama. So this kind of a joke. So yeah, female mosquitoes are spreading the thing, and that's why they use all your, you have to use all your protective measures. Especially in a country like India, you use the anti-mosquito repellents. You are using the mosquito nets. Especially when you look at the prevention aspects, you have to ensure there is no water stagnation. If you look at the Aedes aegypti, it's more like coconut shells and other say rubber tires in your house. The small water stagnation, that's where it breeds. So you should, and malaria, this Anopheles mosquito can breed anywhere in a very bushy area and all that, it can breed. So you should ensure you're using some repellents like say odomas or whatever, some all out or something, or mosquito nets. Mosquito nets can be used. And also the thing is, the day biters are there. You should start using it even in the day also, not only in the night. You should also focus on that. That is about some of the preventive thing also you have to focus, not just on the treatment. And even vaccines are available for dengue. Dengue vaccines are available. For malaria, there is no vaccine available. But for malaria, they will give tablets. The malaria, anti-malarial tablets itself can be used as a prophylaxis. Okay, the symptoms, what I have jotted down. Yeah, as I said, sweating, headache, nausea, vomiting, diarrhea, anemia, these are usually uncomplicated. Whereas for severe malaria, if you're going for severe malaria, I think that comes later on that question, you may go in for cerebral malaria or say kidney injury, multi-system injury, they may go for death and other things. Like you have in dengue also, like 5% may go in for very severe complications. Here also some 5% can go in for this type of very severe life-threatening complication. That is cerebral malaria is most caused by, there are 4 or 5 species of plasmodium that cause plasmodium falciparum, plasmodium vivax, plasmodium knowlesi, like that. In India, plasmodium vivax is a much more common plasmodium. Falciparum is much commoner in Africa and other countries. So that was cerebral malaria is not so common in India, but there are case reports of cerebral malaria. So there is a question, what is cerebral malaria? Cerebral malaria is a part of a multi-organ disease. So it's not only affects the brain is the first thing affected, but it affects various parts of the body also. You may develop severe fever, headache, body ache, then progressively going for delirium, coma. So delirium is acute confusion state. Patient is very confused. Then that could be the sign that this patient, the nervous system is got affected. So some acute confusion state is a dangerous sign. Anybody is having fever and they are also having acute confusion state, they are confused at the same time. That shows that the fever is affecting the brain. Maybe it is affecting the CNS, nervous system. So that could be a sign of meningitis, meningoencephalitis. So the brain has started getting affected. So it could be a dangerous thing. Many times they recover also. You cannot say that all of them will collapse or something. Like even those, some of them also recover and they are normal. Okay. Seizures can happen, fits can happen, retinal changes, vision changes can happen, anemia, blood count can come down, you can have shock, lactic acidosis, respiratory distress, other things could be part of a severe syndrome. Okay. So that is regarding cerebral malaria. And there is a question, what are the psychiatric symptoms of malaria? So I didn't answer that, I think. So acute psychiatric complications that have been described, one thing is cerebral, say once you get cerebral malaria, you can get schizophrenia type of illness or a mania type of illness. You can get depression, you can get anxiety, or you can get delirium, like as I said, amnesia, personality changes. Okay, so these kind of changes, psychological problems can happen. Other psychiatric symptoms, irritability, irritability, anxiety, depression, violent behavior. So these things also can be there if somebody has malaria. Then what are the post-malaria syndromes? Post-malaria syndromes is one thing which happen after malaria. The broad word post-malaria neurological syndromes is used, PMNS is used. It includes delayed cerebellar ataxia, acute inflammatory demyelinating polyneuropathy, which is called Guillain-Barré's disease, acute disseminated encephalomyelitis. So these are like the nervous system start get affected, and these are very severe complications where the neurologist, physician have a much more role to play than psychiatrist. But this is just to know that we should know that severe neurological complications can happen after malaria, and we should be carefully watch them. And if they develop any, say, paralysis, neurological symptoms like walking disturbance, then immediately refer them to the team, medical team, where physician, neurologist, they will be taking care. And it may be very difficult to manage or to ensure recovery and all those things. So like this can happen in very few cases. Like I have not seen many personally, I have seen malaria cases, dengue cases and all that, but this kind of neurological symptoms is much more available in textbook and all that. Like I have not. Cerebral malaria. Cerebral malaria, they suspect somebody goes for coma. Empirically, they diagnose cerebral malaria. They give quinine infusion. When I was a student, they used to give quinine. There is an injection called quinine, which they give in an infusion. Somebody has severe fever, which is affecting the brain. Sorry. And the last question. What are the psychiatric effects of anti-malarial drugs? So the common drugs used, like chloroquine, hydroxychloroquine, these drugs have increased speech output, excessive talking, mania-like symptoms, irritable mood, sometimes psychotic, auditory hallucinations, delusions, even suicidal behavior. All this can happen in some people who take. Chloroquine is a very safe drug. Generally, do not be worried about that. But if somebody is taking anti-malarial and then they behave in a way, then you should immediately stop that particular medication. It may be a side effect of the medication, and you have to switch to something. Then now there are so many other newer drugs available, like RT-meter, and there are several newer agents available. So we can go to some of the newer agents and avoid chloroquine if that is a case. So this is the wide kind of outline about dengue and malaria and psychological side effects. So any questions, any doubts?
I think, sir, everyone is clear on those topics now, because before this session, we only thought of malaria and dengue as some physical health issue. But after this session, we know what are the psychological effects that people face. Because I don't think many of us have gone through that phase of dengue or malaria. So we generally don't know that what are the effects of these anti-malaria drugs, or maybe after post psychological effects. But right now, I think everyone is clear in their mind, and will be able to guide everyone they meet in future, their family or friends. Maybe it was indeed a great session, sir. And I'm really sorry in the beginning when I introduced you, you were not able to listen to me properly, and we missed that part. I'm
No,
really
no, I
sorry
was
for
just
that.
waiting. You said say a few words. Then I was wondering, say, because few words is said by somebody else, right? I'm going to say all the words, right? So the
No,
speaker will
no.
not say few words. Few words will be said by somebody. Then I thought this Animish is going to say
Okay,
something,
okay,
because he was
okay,
also
okay.
not audible and all the other things. So
Yeah, yeah, yeah.
also that's why I was waiting. So somebody to say the few words and then start. Okay. So convey my
Okay, okay.
regards to Sumitra, their family. Uh,
Sure, sir, sure.
Sure,
Thank you
sure,
so
sure.
much for joining with us, sir.
Yeah, it was a great session, sir. We got to
Thank you.
learn a lot,
Thank
and
you.
it
Thanks a
was
lot.
an
Keep up the
opportunity
good
Thank you,
work.
sir.
Thank
Anything
you,
you
sir.
want, you keep in touch with me. I'm ready to take any sessions
Definitely,
on psychological
Yes,
psychiatry.
sir. We have learned a lot from you, sir.
Yeah, yeah. We
definitely,
can
sir.
definitely have more sessions. Thank you. Thank you.
Thank you,
Thank you
sir.
so
Thank you,
much,
sir.
sir.
If there's nothing else, I'll wind
Thank
up.
you,
I'll
sir.
leave the meeting. I'll wind up.
Okay,
Sure,
thank you
sir.
so much.
Thank you so much, sir.
Bye, guys.
Shreyas recording.
Bye, bye.
Bye, AP.